Good morning, welcome to the first JIB webinar of the year. We're going to be covering, as we've done in a couple of times in the past, the JIB benefit scheme, but we tend to put a bit of a slant or a focus on something sort of particular, which today will be sort of mental health, EAP support and sort of and cancer treatment options. But we'll be covering, I think, the whole sort of gamut of the JIB sort of benefit schemes. My name's Roger Horn. For those that don't know me, I'm head of membership at JIB. Joining me this morning is Craig Murray from Bupa and Rob Lowe from ECIS, who, if you've been on any of our webinars before, you may have seen them sort of before. So thanks for joining us today and interrupting your busy schedules. And just for a bit of context, JIB benefit scheme is a uniquely packaged scheme to look after the health and well-being of employees covered under the JIB agreement. And the scheme is really a cornerstone of the agreement and offers a comprehensive package of support. And following sort of our previous sort of webinars, I get sort of particular sort of questions about particular aspects of the benefit scheme. And we've had a few sort of questions around cancer treatment and mental health support, which is why that's kind of a theme sort of today. The webinar is going to be recorded and we'll place that on the JIB YouTube channel. Yes, we have a YouTube channel. There is a Q&A facility, so feel free to add questions as we go. We'll more than likely do a sort of session towards at the end, sort of picking up sort of any questions that people have raised as we go. So without further delay, let me first introduce Craig from Bupa, who will talk about Bupa sort of highlights. Over to you.
Thanks, Roger. Good morning, everybody. My name's Craig Murray. It's a pleasure to be here with you today to talk you through all the benefits that are available through Bupa and how we can support you and any family members that you have on cover. I'm just going to share my screen. Hopefully, you can let me know, Roger, that's come through.
Yes, I can see that. Yeah, that's fine. That's fine.
Perfect. So I'm going to spend around 20 to 30 minutes talking you through the benefits that you have through Bupa. But I suppose the first step I would recommend anyone to take is to download the My Bupa app. As a Bupa member, you have access to My Bupa, which is where you can manage your private medical cover, check your claims history. You can also request treatment and also access digital health support. It's easy to get going. All you need to do is download the My Bupa app straight to a smartphone, or you can register an online account that you can access through laptop or through desktop. Additionally, you can scan the QR code that you can see on the screen there as well, and that'll allow you to follow the steps to create the account. And once you've created your account, you'll be able to see the details of your cover, access treatment, and see all your policy details within the app. Once you've created your My Bupa account, this is where you can access Bluer Health, which is where you'll find the virtual GP, and you can book virtual appointments all through the app. You have access to GPs, nurses, and other health experts by phone or video, and you can do this at a time that works for you. Within the My Bupa app, you also have access to our digital wellbeing services, which include our fitness centres, which we'll talk to you about later in this presentation. If you're already a Bupa member and you've not yet downloaded the app, I would certainly encourage you to do it, as it's a great resource, and often our digital appointments can be accessible within 24 hours. The next few slides, I'll be talking to you about some important information regarding your policy, regarding excesses, any underwriting, and cash benefits that are available. So we'll start with your excess. So your scheme has a rolling excess of £150. So this is the amount of money you contribute towards treatment costs, and once this has been applied, we'll cover the rest up to your benefit allowances. You'll only need to pay an excess once per rolling 12-month period, no matter how many times you claim. So the excess applies to each person covered under the scheme, applicable to each member. It's also important to note that the virtual GP service in the My Bupa app, this does not trigger the excess on the policy. So if you do use the GP service, that's separate through to the insurance. I'll give you a quick example of how the excess works, just so you can fully understand that. So your excess is £150. If you needed physiotherapy for a bad back and make a claim for treatment in November 2025, this costs £300. You'd pay £150 excess and we'll pay the rest. If your back pain was to persist in August 2026, you need another course of treatment costing another £300, As you've already paid your £150 excess in the last 12 months, we'll just pay £300. So through the scheme, your employer was chosen for the underwriting on the policy to be medical history disregarded. The scheme's underwriting means that we won't take into account your previous medical history, so you're covered for any condition that is eligible under the rules of your scheme, regardless of when you were previously diagnosed or when you first experienced symptoms. You also have cash benefits available through the scheme. So if you choose to receive eligible treatment on the NHS, instead of using your private cover, we'll pay you a cash benefit. Cash benefits can help with everyday costs such as travel expenses, hospital car park costs, or childcare expenses. We'll pay you a cash benefit for every night you spend in hospital, up to 35 nights per person per scheme year, and the benefit amount for this is £200 per night. If you was receiving cancer treatment on an outpatient, day patient, or inpatient basis on the NHS, you can also claim £100 for each night or day that you receive the treatment on the NHS. Additionally, for some specific treatments you may receive on the NHS, you may be able to claim for a procedure cash benefit, which is effectively a lump sum of money for your admission for that treatment. For more information on the cash benefits available, you can find the detail of the policy documents, or you can contact the helpline who'll be able to assist you further. The next few slides, I'm just going to talk to you about how to claim through the policy and the different access points that you can access treatment from. So first of all, what I would say is if you do have any signs or symptoms relating to signs of cancer, such as any lumps or abnormal changes, or if you've got any symptoms around muscles, bones, and joints, you have access to what we call our direct access service. This means that you can contact us directly without the need of seeing a GP first. We can do an over-the-phone triage and check that your symptoms are covered under your policy. And if the treatment is eligible, we can authorise your treatment and guide you on the next steps to get support. This essentially removes the need to see a GP first and gets you faster access to treatment that you need. If you do want to access this service, the number to call is on the screen, which is 0345 609 0444. If your symptoms aren't related to cancer, muscle, bones, and joints, then you should speak to a GP first. As I mentioned on the previous slide, you can access the digital GP through the My Bupa app to book an appointment, or you can use your own NHS GP for a referral if preferred. Once you've had your appointment with the GP and the GP does want to refer you on for further treatment, we would ask that you ask the GP for an open referral. And an open referral is essentially, it's not addressed to a specific consultant. And what that means is when you call Bupa, we will then be able to guide you to consultant. We usually provide you up to 3, and that means you are then able to contact the consultant and you can have a choice of who you may be able to see. We'll also then provide you with the pre-authorization code and support you through the next steps of how you then make arrangements with the consultants. So just touched upon open referral there, but essentially the open referral is not a named consultant, and what that means is we can then guide you to a range of consultants through the policy. Having more of a choice of consultant means you're less likely to encounter delays, for example, if your first choice of consultant isn't available. The consultants that we have within our network meet high standards for clinical practice and criteria, and they're also selected based on the value they offer, the quality of care, and their customer experience. You'll always be offered a fee-assured consultant. So what this means is they've agreed to charge within the Bupa rates for any eligible treatment. So if your treatment is authorised and eligible under the policy, you won't face any unexpected bills and it will be fully covered by your policy. For the next few slides, I'm going to focus on your physical health. So going back to muscle, bones and joints. So whether it's a bad back or a painful knee, Bupa's here to get you moving again. We have a nationwide network of professionals such as physiotherapists, osteopaths, trauma and orthopedic surgeons, and MSK physicians to support you with any muscle, bones, and joint conditions. You can call us on the number on the screen on 0345 600 8277 You can also start a web chat or use the MyBupa app to access treatment. You could get specialist help or advice, often needed without the GP referral first. As mentioned, you can use our direct access service. So if you did have any worrying symptoms relating to breast, bowel, or prostate cancer, you can access our specialist centres via our direct access service or via a GP referral. We will aim to get you an appointment within 4 working days. And essentially, you can attend the appointment. You can either get the all clear by having an initial diagnostic test in just one appointment, or if any referrals are required, such as further tests, this can then be referred for and they can be done within 5 days later. Hopefully, it'll be nothing to worry about. However, if it is cancer, your treatment will start within 31 days from your first call, which is half of the national standards that you would see on the NHS. So your policy does cover cancer cover, so you will get access to treatment and support delivered in partnership with your consultant. It's Bupa's promise to be there for you with a personalised care at every step and do everything we can to help you get back onto track and feeling yourself again. You'll have access to the latest evidence-based and licensed treatment within the UK, even if it isn't approved by NICE or available on the NHS. There are no time or financial limits on our full cancer cover, as long as you receive care from our recommended consultants, hospitals, and clinics. So if you do notice that's something that doesn't feel right, please give us a call as soon as you can. As mentioned previously, there's no need to wait for a GP referral. We'll check your symptoms over the phone and give you clear advice on what to do next. If you were to have any worries about concerning moles or skin lesions, we do offer a remote skin assessment service, which can help you get them checked for signs of skin cancer or from your own home. This service is available nationwide and can be used for up to 3 moles or 3 skin lesions. All you need to do is give the helpline a call. Again, there's no need for a GP referral. Our service team will send you a link to register for the service. You'll then receive a home assessment kit, which includes a smartphone and a dermoscopic lens. And you can use the kit to take images of the lesions, and then you send these back via an app. A dermatologist will then review the images, and the results will be ready within 2 working days. If, of course, any further treatment is required or you do need to be seen by a specialist, we will then be able to arrange that onward referral for you. We also have what we call our rapid cardiac assessment. So if you're referred to a cardiologist, you can access our rapid cardiac assessment where you're able to speak to a cardiologist. And again, that's in within 2 working days of calling, and that can be done from your own home. All you need to do is contact the helpline for a pre-authorization. They can arrange a virtual consultation with a cardiologist, where you'll be able to then talk through your symptoms and discuss this directly with the consultant, again, within 2 working days. The cardiologist can then refer for some diagnostic tests if required, and some of these are even available from your own home. You will then have a follow-up consultation, and the cardiologist will advise if further treatment is needed. Obviously, if there's nothing to worry about, they can then discharge you and provide you with a medical report that you can then share with your GP. So the next few slides, I'm going to be talking through mental health support that's available to you and anyone who's on the policy. So initially, just want to make you all aware that as part of your cover, you do have access to Healthy Minds EAP. EAP is short for Employee Assistance Programme. Essentially, you can talk to a trained advisor about anything that's worrying you, and our Healthy Mind service offers a listening ear for a range of personal and work-related issues. We keep things confidential, so Healthy Minds is completely confidential. We won't tell your employer or anyone else that you've been in touch with us. And we can also offer an online mental health assessment, and once completed, you'll be guided to a range of support options. So the things that we are able to help with via the Healthy Minds EAP service is for things such as stress, bereavement, coping with change, financial worries, anxiety and depression, substance misuse, care for an elderly relative, or any family issues. If you need help for a common condition like depression or anxiety, you'll be given access to a CBT program that's online, where you can access support by one of our therapists. So we all know that it's good to talk, especially if you aren't feeling yourself, and we're here to listen, give you advice, and even refer you to a specialist, as your policy does cover for mental health. With Bupa, you're covered for more mental health conditions than with any other UK leading insurer. We offer a wide range of treatments, including counselling, CBT, psychology, and psychologist appointments. As a member of the medical benefit through Bupa, you also have access to our family mental health line. This helpline is there for any support you may need if you're worried about your child's emotional well-being, which we are aware is more and more children are experiencing symptoms of mental health. You can use the helpline service even if your child is not covered on your Bupa policy. Our mental health nurses will provide advice and can signpost to resources to support you and the family if you do need support with mental health. The contact number's on the screen there, but I would make note of it. It's 0345 600 5446. Additionally, we also have Jack, and the abbreviation for that is Just Ask a Question, which is essentially a digital platform that connects you to doctors, Bupa clinicians, wellbeing experts, and celebrities on a range of health and wellbeing topics. The experts cover more than 70 different health and wellbeing topics, including mental health, diversity, inclusion, neurodiversity, and leadership, with over 20,000 questions covered. From April onwards, Jack will be available in the My Bupa app, which will include even more content with over 150 specifically focus areas on workplace wellbeing. The next few slides are just going to be talking around your everyday health. So really important that we've got 3 health lines here. Again, the numbers I can share with you at the end of the presentation, but essentially we've got our Anytime health line. And so this is similar to the 111 service that you get through the NHS. But if you have anything that is worrying you day or night, our Anytime helpline is available to anyone covered on the medical benefit. The helpline is available 24 hours a day, 7 days a week, 365 days a year, with a team of nurses available to support you. Helpline nurses are there to support you with any health-related questions or concerns, whether that's urgent or not urgent. We also have a menopause helpline. So this helpline offers support by our specially trained menopause nurses, whether you are experiencing symptoms of the menopause or you're wanting to feel prepared for any symptoms that you may face. They can offer advice and give you guidance that you need, even if it is to support a loved one and it's not actually yourself that is experiencing any symptoms. I did touch upon this on a previous slide, but we do also have our family mental health line. So this helpline is there for any support you may need if you're worried about your child's emotional well-being. Again, you can contact the service even if your child's not covered through Bupa, and our mental health nurses will be able to advise and can signpost to resources to help you and your family. Also, once you've got your account created in the My Bupa app, you do also have access to our digital wellbeing services, which includes our fitness centre, and this is where you can view and participate in on-demand or pre-recorded fitness classes, and also our everyday wellbeing, where you can find meditation spaces and wellbeing articles and videos. You can improve your mental fitness with guided meditations, join a fitness program to learn new exercises, start an exercise plan, which are tailored for all people, whether that's from a beginner or to someone who you would say is advanced. This is all accessible in the fitness centre on the My Bupa app. So looking through the family cover that you have, if you've got any dependents on your policy. So if you have added any family to your policy and they are over 16, you can also encourage them to download the My Bupa app. This allows them to book their own digital GP appointments if needed, request their own treatment through the app, and also they have access to all the on-demand fitness classes that we've just discussed. So we do also have support for young people's mental health. So when you're unsure of what to say or do, with the right support and groundbreaking access to treatment for the people that you love most, specifically for young people, we know the waiting list on the NHS for mental health support is extensive, and we understand some things just can't wait, which is why we aim to provide access to treatment within 10 working days from a referral. We've got loads of free resources that you can access online, from toolkits, guides and videos and podcasts, all designed to get you and your child working towards better mental health. If you're worried about a child's mental health, as mentioned on a couple of slides, do call our family mental health line to speak to a healthline nurse. Again, they'll be there to listen to connect you to the right support, again, whether your child's covered or not. So you might just want to save these numbers. These are always really handy to have saved in case you do need to contact Bupa. But to essentially to get in touch with us for the direct access services or to pre-authorize any treatment, it's the main number you can see on the screen there, which is 0345 609 0444. I've also included on there our anytime helpline number, as you can see, 0345 601 3216. And for the family mental health line number, it's 0345 266 7938. And that brings me to the end of the presentation. I believe I'm handing back to Roger.
Great, thanks, Craig. It's great. I mean, when I always think that I've got a bit of a grasp on what covers involved, but whenever I hear you or your colleagues talking, there's always things that I learn that are different. I mean, we're starting to get a couple of questions in, but I think if we hand over to Rob, who's going to talk to you about the other elements, kind of the non-Bupa elements predominantly, but perhaps other stuff to do with the JIB sort of benefit scheme. So Rob, so should we hand over to you?
Absolutely. Okay, let me just get the slideshow set up, just a moment. Okay, so you should see that, Roger, I hope.
Yes, yeah, I see that.
Great. Okay, so thanks for having me. I'm here to just take you through some of the main benefits of the JIB benefits package that we manage at ECIS. So these are the topics that we're going to cover: private medical cover, sick pay, death in service cover, personal accident cover, occupational health assessments, and of course some time for questions. So first of all, the private medical cover. Let me just check the order of my slides. It looks like I've left out the one for private medical cover, but in any event, Craig has gone through that in some detail. But just to summarize, of course, it is a comprehensive private medical insurance scheme. Craig's talked about some of the individual features of that, but the headline features are that there's a £1,750 outpatient benefit for testing and consultations with specialists. And it's a comprehensive policy, which means you need to go into hospital overnight or for the day. If you need surgery, if you need cancer treatment, there are no annual limits on those items. They're covered fully, as long as you're using a specialist in the hospital that is recommended by Bupa. Of course, it's an open referral system. A little bit of information about the sick pay on the scheme. Now the JIB rules specify that sick pay must be provided to operatives at the rates you can see on the screen now. The JIB benefits scheme provided by ECIS provides sick pay cover for JIB employees to cover that liability. Employers become eligible to claim sick pay in respect of their operatives immediately after their first successful payment on the JIB scheme. They remain eligible as long as the eligibility criteria are met. There is a 2-week waiting period before sickness benefit is paid. And after 8 weeks of continuous sickness absence, there'll be a payment for waiting days 8 to 14. So that's the second week of the claim. That'll be made retrospectively. There's no payment for days 1 to 7. So that isn't made retrospectively. It's simply not available. And the sick pay benefit is not available to apprentices. Now, of course, the intent behind this is to make sure that your operative is supported during a period of sickness and therefore remains able to return to work when they recover from that sickness. It catches those operatives with a safety net to ensure that they're not left without any support during those periods where they're unable to work, and it avoids a scenario where that operative then has to look for other employment or is unable to return to employment after a period of sickness. So just make sure that they are looked after from that point of view. You can see on the screen the different amounts that are paid for the different periods of sickness, and these slides, of course, will be made available to you by Roger after this webinar. There is a death in service benefit of £40,000 for death by any cause. And if death results from an accident while commuting, there's a personal accident payment, which increases that total to £52,500. And there's an additional benefit for accidental bodily injury at work. And if that results in the death of an operative, then overall, the death in service benefit then grows to £110,000. So there are different amounts there available for different things, to give you some support, to give families some support in the event of death of a loved one. There is some death cover as well for apprentices. So there's life insurance for apprentices of £10,000 for death by any cause, and an accidental death benefit of £25,000 if it results from an accident at work or on the daily commute. And that brings the total available there to £35,000. So apprentices are looked after as well. Now, we've talked a little bit about just then about personal accident cover, but just to expand on that a little bit, there's £25,000 in the event of accidental bodily injury that results in an operative's permanent total disablement from the usual occupation. That increases to £50,000 if it results from an occupational accident. That doesn't include commuting. And there's a permanent disablement benefit of £25,000 for operatives that suffer the loss of a limb or permanent total loss of vision. And again, there is some support for apprentices. We've talked about that in the last slide. There's permanent and total disablement benefit of £10,000 where the apprentice has, through injury or disease, suffered loss of a limb or total loss of the use of a limb, or permanent and total loss of vision, and who, as a result of that disability, are unable to work as a JIB graded electrician at any point again in the future. So there is some support there for apprentices. And there's cover for occupational health assessments. Now, employers can get funding for each assessment from ourselves at ECIS up to the cost of £85, excluding VAT, or the cost of the assessment, whichever is lower. There's funding for one assessment per registered operative every 3 years. It's not a requirement of the JIB or the scheme to provide an assessment, and it's not mandatory for the operative to attend if they don't want to, but the offer is there for cover for that assessment. And as a minimum, that assessment has to cover the items that you see on the screen at the moment. So just to call out a couple: vision, blood pressure, colour vision, and mental health or workplace stress assessment are included. So there's a variety of things that, as a minimum standard, are included within that assessment. And of course, as I say, these slides will be made available to you after this presentation so that you can forward any questions to us or approach us directly, of course. My contact details are on the screen there. I'm easy to get hold of, always happy to help. And if you don't have those to hand, then Roger, of course, will forward any questions that you have to me directly. But please do share any questions that you've got about that benefits package. Roger will be happy to forward those to us. We'll be happy to help. So yeah, any questions, please let us know now.
Yeah, great. Thanks, Rob. Very, very, very comprehensive. Yeah, we've got one or two questions coming through the Q&A. I'm getting sort of questions via other routes, so I've got a few questions to kind of sort of cover off. But I'll cover one off that's this might be for you, Rob.
Okay.
It's does it depend? I'll read the question. Does it depend on what kind of cover scheme you have as to what is included within your cover? I think I might be interpreting this sort of question as to some of our members will have, correct me if I'm wrong, Rob, and I'll let you sort of pick it up, office staff scheme cover, which is different to the cover that's within the JIB benefit scheme for operatives. Sorry, you
a little bit, yeah. No, it's a good question. So the private medical insurance element is common across both office staff and operatives, and it is in terms of the level of cover provided, it's identical except potentially for the underwriting. And I'll pick that up separately just now, actually. So if you're an operative, you've got this private medical insurance package as outlined by myself and Craig. And as an operative, it's medical history disregarded, which means it covers pre-existing conditions and symptoms, regardless of when they first presented. And as an operative, you also have those additional benefits, so death in service, for example, and permanent total disablement. If you are office staff, you don't have those additional cash benefits like the death in service, the holiday pay. Sorry, I should say sickness pay, not holiday pay. But you do have the private medical insurance element, and that might be underwritten a bit differently depending on the arrangement that you've come to. So just to clarify, office staff have the private medical insurance and the private medical insurance only. Operatives have both the private medical insurance and the additional cash benefits, including sick pay and life cover, for example.
Great, thanks, Rob. Perhaps it's between Rob and sort of Craig, but and you've just mentioned it, sort of Rob, but medical history disregard versus other kinds of underwriting is that unusual? Medical history sort of disregard? Unusual?
It is. Yeah, it is. This might be something for people to approach me about directly, so I can answer their individual questions, because this is going to depend partly on the arrangement that your employer has with us.
Of course.
But for operatives, medical history disregarded cover is as standard. For office staff, it is unusual. We have a lower attachment point for that with Bupa as a result of the relationship that we have. And that means that it's available for employees at no extra cost for any employer that's insuring 10 or more individuals, 10 or more employees. There is an additional cost for spouses to have that cover. There isn't an additional cost for children. So if you've added your children to cover, they will always be MHD. But if you add your spouse, your partner, your wife to cover, there is an additional cost for them to have that MHD cover. And that just is a result of the fact that, of course, this is a risk-based product, and there is a greater claims risk in our experience for spouses and partners to have that MHD cover. There is the availability of underwritten cover, so with either moratorium underwriting or full medical underwriting. But again,
what does that mean, Rob? Sorry, what does that when you talk about moratorium or sort of
moratorium underwriting means pre-existing symptoms and conditions aren't covered from day one, but subject to a qualifying period free of treatment or advice for those conditions, they may fall under cover in the future. It's not a guarantee, but it is an opportunity for them to become covered if you have that trouble-free period. Full medical underwriting means you complete a questionnaire at point of joining, and Bupa, not Craig personally, but someone at Bupa will take a look across that, and they may apply terms or exclusions for any symptoms or conditions that you've disclosed on that form within that questionnaire, and those terms or exclusions will remain on the cover, so they won't fall off in a way that they would potentially with moratorium underwriting. Craig, are you happy the way I've explained
beautifully,
that?
Rob. I was just going to jump in and say, explained very well.
Good to hear. Okay.
Yeah. So this is probably so just a couple of things. So direct access services, it might be sort of Rob or sort of Graham, but direct access services is about but using a telephone number sort of largely. Is that accessible using the My Bupa app, sort of going through I'll call it your digital GP access or
Craig, I'm very happy for you to pick that one up.
Yeah, no, I can pick this up. So you can sort of request, because it essentially the triage service, you have to go through a triage, so you can initiate that conversation through the app, but essentially you will need to speak to someone on the phone, because what they do is ask a range of questions around individual symptoms, just to make sure it is meeting our eligibility, and they can then do that referral for you. But we do need to have that conversation on the phone. So yes, you can use the app to initially get that ball rolling via the web chat service or requesting treatment, but we will need to speak to you to do that triage.
Sure. But could the digital, the GP via the app do that conversation? Or is it got to be like
I see. Sorry, I understand. So if you were to access the GP service, i.e. you had an appointment with a GP, and they referred you, then you wouldn't need to have the direct access service, because you've got your GP referrals. So either options are fine. The direct access service is more if you for whatever reason, it shouldn't come to that, but you wasn't able to get a GP appointment, or, for whatever reason, that's just an additional service where you can just go straight to us without needing to see the GP first. So what you may find is, obviously, you've got, say, let's just talk about a bad back, for example. You've got a bad back, you go to book an appointment, that's tomorrow. We can actually get you an appointment today for the triage. So it just cuts out that need to see a GP if actually you can just access the service using our direct access.
Brilliant, lovely. Okay, we have got a few on the Q&A now. Is there anything in place? I think it's probably one for me. Is there anything in place or an alternative to the old health checkups that used to take place? So I think what this attendee is referring to is the Bupa personal health assessments that I think we used to offer pre-2018, and this is, I think, a change came about from like the JIB sort of the direction of travel being that they were looking at an assessment that was much more closely aligned to the work of an electrician, which clearly it's a very different. The occupational health assessment that Rob refers to is very different from the personal health assessment. The personal health assessment are still available at a cost. Please correct me if I'm wrong, sort of Craig, but I think there are there discounts through the Bupa rewards sort of scheme if you want to sort of take it up yourself.
If you did want a health assessment, you just call that main helpline number that I give you at the end of the presentation, and they'll be able to then do that. And you, as a Bupa member, you will be entitled to some discounts. That would need to be discussed directly with the team.
Of course. Are there any plans to offer mental health support to apprentices as their most vulnerable age group? As it stands at the moment, the full benefit credit for an operative is, and do correct me if I'm sort of, because this is, I suppose, a bit more about JIB agreement than necessarily sort of a health cover, but within the full operative sort of cover, there is the mental health support that Craig and sort of Rob, but Craig has outlined in some sort of detail within the obligations of the JIB agreement. The benefit credit for apprentices that you would have to sort of purchase covers the death in service, personal accident cover, disability sort of cover insurance. We have members, and feel free to approach me kind of sort of directly, sort of offline, but we have members that will purchase the full JIB benefit credit for their apprentices, which is a choice for the organisation, either at a certain stage of the apprentices sort of a course, sort of stage 3 or 4, or they just offer it to their apprentices as a matter of course. There are other agencies like the electrical industry sort of charities that can offer sort of like an employee assistance program support offline, but it's something that we're constantly sort of looking at and reviewing, and obviously my industrial relations colleagues I'll sort of feed these kind of questions back to them sort of as well. Do correct me if I've said anything sort of wrong there, sort of gentlemen. Just another one. So, under what circumstances, it might sound an obvious question, would people be coming to Bupa sort of talk about a particular sort of claim versus going to ECIS? And this might be a very obvious kind of sort of question, but are there certain parts of the JIB benefit credit where they would go to ECIS or use, I think, the Canopy portal, or go direct to sort of Bupa? What the sort of the differentiation sort of between the two? Rob or Craig can sort of pick that up. I don't think I've asked that very clearly, to be honest with you.
I'm happy to jump in. I think, Roger, I think if I understand your question correctly, so obviously anything where it's, medical related and you're needing treatment, then obviously contact Bupa. We're there to offer that support and help you get treatment. And then I think anything outside of that would then fall with Rob. Correct me if I'm wrong.
Yeah, that's right. So so if you have a claim for anything that's not under the private medical insurance, that would be via the ECIS admin team. They'll take care of that. But any questions about how the cover works, anything that appears to have gone wrong, anything that you just want to chat through with somebody, I'm always happy to take those questions.
So they can come and talk to ECIS about kind of any elements of their cover, but for Bupa related claims, they've got a direct kind of relationship as an individual with Bupa. Sort of, would that be a fair way to sort of describe it?
Yeah, that's right.
Yeah.
Great. Now, is Bupa linked in with the JIB membership? It's this is one kind of for me. Yes, it is. It's part of the employee benefits package known as the JIB benefits scheme, which is specified within the JIB handbook and the JIB agreement. So the short answer to that question is yes, the Bupa cover, the private medical cover that we have within the JIB agreement for our operatives comes from Bupa. So it is inextricably linked with sort of JIB membership. So probably one more for me. Can I still make a claim if I can't get hold of my GP?
Yes. Well, if it's for symptoms of what I mentioned earlier, so any signs of cancer or anything MSK related, obviously you can use our direct access service, which obviously removes the need to see a GP. I'd hopefully like to think that was around your NHS GP, because our digital GP support available through the MyBupa app. There's often appointments available within 24 hours. So if you didn't have any symptoms that weren't related to worrying signs of cancer or MSK, you could book yourself an appointment through the MyBupa app, and I can access a GP that way as well. I hope that answers your question, Roger.
Yeah, I think that's great. You might have answered this as you sort of talked through things through sort of Craig, but does using the digital access to the GP through the MyBupa app trigger the excess?
No. So anything that's done through the MyBupa app, so your digital GP appointments, nurse appointments, you can even access physiotherapy on there. Anything that's online through the app doesn't trigger the access. Only when a referral is made and you actually get a pre-authorization number for onwards care, that's where any accesses will be applicable for any claims that we receive to the insurance.
Okay. Kind of connected ones, and I think you did touch on it. Bupa have given me some specialist sort of names. How do I learn more about them? And a kind of related question: what does fee assured sort of mean? Sort of when you're sort of looking at those kind of options of consultants, I'm sort of guessing. I think that the person's sort of talking about.
Sure. So for your first question, so when we guide you to a consultant, we'll often send you an email with the details of that consultant, where they has information about them on there. So it'll show you any information around sort of their speciality areas, what their focus areas are. And when I say that, I mean, if they're a trauma and orthopedic consultants, is it the back, is it the hip that they sort of specialize in? So we have a profile of information on them. Additionally, if you really wanted to look further, obviously they'll all be GMC registered, and you can access that online and put in their name, and that'll give you information around them as well. So either way, you can check detail. Into your second question, Roger. So fee assured. So essentially, we have fee assured consultants and non-fee assured consultants. So under the policy that you have, we on the open referral scheme, we guide you to fee assured consultants. But what that means is if any eligible surgery was required, so you needed any kind of surgery, we have agreed rates with these consultants, and they will effectively charge within that rate. So what that means for a member is, as long as it's eligible treatment, there won't be any unexpected bills. So if I give you on the other side of a non-fee assured consultant, if surgery was required and you were under the care of a non-fee assured consultant, they essentially haven't agreed to the Bupa rate. So say the surgery cost £1,000, they can charge anything above that. And in that scenario, it would then be the customer who would then pay that shortfall. But that won't be applicable on your scheme because we'll always guide you to someone's fee assured. So essentially means if eligible, it'll be fully covered by the policy and you won't have to contribute anything apart from any access if applicable.
So that's that fee assured sort of thing. It's the thing to sort of look for when we get if
Yeah.
people are accessing sort of.
Yeah, so we'll always guide you to fee assured consultants anyway when you do call the helpline. So that'll be, we'll give you a choice. If for any reason you needed more, you can always call us back. And then there's also what we call our Bupa Finder website, where you can actually locate consultants yourself. And that also details the ones that are in the network. And it clearly shows you with a green tick that they're fee assured as well.
Okay. Under what circumstances can I claim? This might be, another one for you, Craig. Under what circumstances can I claim cash when I'm in an NHS hospital, and how? So how do you do it? What kind of evidence is required, or that kind of sort of thing?
Good question. So essentially the NHS cash benefits is applicable to any treatment that you've received on the NHS that you could have essentially used Bupa policy for. So we would pay the cash benefits up applicable to the amounts for any treatment that you did receive on the NHS if it was eligible through Bupa. So what you would need to do is, obviously, if you were, say, an inpatient on the NHS for 2 days, 3 days, whatever that is, you'll always be provided with a discharge summary. And that just details when you were admitted, why you were admitted for, the treatment that you received while you were an inpatient, and then the discharge date. You then need to send that in through to us, and then that will go to our claims team to assess. And if all eligible, they can pay out the cash benefit.
Okay, that's quite straightforward. Where can I find my policy documents, numbers to call? Obviously, you've quoted some sort of telephone numbers as we've gone through, but I think this is what I think referring to sort of Bupa sort of policy.
Yeah,
I'm pretty sure this question's referring to.
Yeah, sure. So best place to find all that information is through the My Bupa app. So once you've created your account, you'll then be able to go in there. You'll be able to see all the details of your policy. So it'll have like your full membership guide. It'll have the contact numbers that you need to ring. It'll show you who's covered on the policy as well. So if you've got your family members, etc., it'll give you all the details regarding who's covered on your scheme and how to get in touch with us.
Okay, great. I think one for you, Rob. You've mentioned it. Dependent cover. What if people are interested in sort of dependent cover? What would they sort of need to do?
In the first instance, get in touch with me. So for operatives, of course, operatives are invoiced weekly and paid monthly. But dependents are invoiced yearly and can either be paid up front for the year or on the basis of an interest-free direct debit monthly. But if you're interested in the rates for adding dependents or the underwriting basis or the level of cover that they get, just reach out to me. We can have an open and obligation-free chat about how that would work and what the cost would be.
Great. What we can do, we'll sort of share those numbers after. I think we've pretty much gone through all the questions. Yeah, I think just checking what I've got on the Q&A and questions I've come through any other way. That's been a fascinating insight. Thanks, James. One of the challenges that I have is getting information through to our operatives, and ECIS have come up with quite a good kind of sort of one-pager. But I think there's something that we probably want to sort of revisit in the types of collateral, how we can get this information through to operatives, because the companies are buying this cover for their operatives, and that's a constant question I get is the kind of collateral, just ways of communicating. I mean, the myriad ways of communicating with Bupa, it's great, but I think in some ways can be also a bit overwhelming, because you've got, so do I give them a phone? Do I pick up the app? Do I go direct access services or something? Which is great for the different convenience, but you kind of need to know which is the best box for you to sort of like fit into to sort of to continue through. So I mean, perhaps that would be, I mean, they may contact me in the first instance, but that's something I could kind of direct perhaps to you, Rob, sort of if there was a query sort of around that.
My advice would be, if you have a medical problem, Craig, let me know what your thoughts are on this, but I think the best approach would be one of two options. Firstly, if you have symptoms and you think you might want to use your Bupa cover, pick up the My Bupa app and book an online digital GP appointment. that should be a first port of call. But separately to that, if it's one of those 3 direct access issues that Craig has talked about, so musculoskeletal problems, mental health problems, or suspected cancer problems, there are the direct access routes as well. So Craig, what are your thoughts? I think it'd be one of those 2 routes.
Yeah, I think you covered it well there, Rob. I think essentially, you know, we've got a dedicated team of very experienced advisors. I think, you know, my best advice is obviously, you know, there is elements that we need to get the GP referral if we can't access the direct access pathways. But the team are there to help. Any questions that you've got, any concerns, you know, they can give advice. I would always say, if you're unsure or you want to, you know, talk anything through, just give the helpline a ring.
Yeah.
They're open from 8 a.m. to 8 p.m. Monday to Friday, 8 till 4 on a Saturday. And they're, you know, they do a fantastic job, and they'll be more than happy to support you with any questions that you've got.
Great. Gentlemen, so thank you very much. I think we've gone through. Oh, hang on, we've got another one. Sorry, no, you think just when you thought it was going to be safe to get away. Will the slides? Yes, yes. So yeah, the question is: will the slides presented on the call be shared after the webinar? They're good to circulate to our engineers. Kind of answering a question. Absolutely. The webinar's been recorded, so it will go on our YouTube channel. As I say, you know, people probably didn't know the JIB had a YouTube channel, but we do. So it'll be there sort of to watch. Yes, we'll share the slides afterwards. And also there's a little plea from me. We'll also send out a sort of feedback survey link, just 2 or 3 sort of questions, which would be really helpful for us. If you could take just a couple of minutes out of your time just to let us know your thoughts, sort of, you know, sort of good or bad, because we won't improve unless we get good comments from you. So with that in mind, thank you, Rob. Thank you, Craig. It's been fascinating. As I said, I always learn stuff about this. I think I know the highlights, but there's always sort of bits that are interesting, and I'm sort of talking to members all the time. So whilst I don't, no way would I try to sort of advise, I can signpost people sort of to the right directions, and that's what I find really useful with these sort of sessions. So thanks very much, and have a good day, and thank you for everyone for joining us, and we will no doubt sort of talk again soon.
Thanks everyone.
Thanks everyone.
Bye-bye.
Bye.